Hello everyone, I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be speaking about nutritional intervention for the cancer patients who have diabetes. It's very important to understand what is the dietary approach or the nutritional approach when a cancer patient is undergoing cancer related treatments, and also how to monitor their blood sugar levels. In today's talk, I shall be covering the following topics as to what is meant by diabetes and what are the two main types of diabetes. Okay, how can we ensure to prevent hypoglycemia, and at the end, I shall be also discussing with you the dietary tips which can help in glycemic control. And most importantly, we shall be also throwing light upon what is meant by glycemic index of a particular food as well. So to start with, let us first try to understand what is meant by diabetes. So diabetes has been defined as a condition wherein there is a higher concentration of the sugar levels in the body. This could be also because of insulin secretion, which is more, or because of the insufficient insulin production in the body. There are two types of diabetes. One is type 1 diabetes or type 2 diabetes. Type 1 diabetes is also known as insulin dependent diabetes mellitus, whereas type 2 diabetes is also referred to as non insulin dependent diabetes mellitus. What generally happens in diabetes type 1 is that there is a destruction of the pancreatic beta cells. Pancreas is the main organ which is going to help in the production of insulin, which is an hormone. Okay, so when there is a destruction of the beta pancreatic cells, there is going to be a destruction of insulin production as well. This generally occurs at a younger age, and they have to be dependent lifelong on insulin as well as an external source, which is going to also help them in the production of sugar or insulin, which is important for glucose metabolism as well. Next is type 2 diabetes mellitus. Here, what happens is because of the insulin resistance, there is insufficient insulin production. Now, insulin will act as a lock and key for the entry of glucose into the cells. However, when there is a load or stress in the pancreas, there is insufficient production of insulin in our body, due to which there is not enough of insulin which is being secreted, which is going to be helping in the production of insulin to help glucose enter the cells, which is also not only important for energy production but also important for the various cellular function which take place at the molecular level. Going to the next aspect, let us try and understand what is meant by glycemic index. Now, glycemic index is termed as a blood glucose response with the ingestion of a particular food. Now, there are certain foods which, when we consume, are going to have an impact on the blood sugar levels as well. For example, there are certain foods which, when we eat, are going to cause a early spike in the sugar levels. Whereas there are certain foods which, when we eat, are going to cause a release of the sugar in a steadily manner as well. So it is very important in understanding what foods are actually supposed to be consumed during this time, so that it is also going to help in regularization of the blood sugar levels. Especially now, when we see in cancer patients, they are undergoing various treatments which are of cancer, and due to that they are also going to have a certain side effects or symptoms which they will face. Now, generally, we see that they also have a loss of appetite. They tend to not feel hungry as well. Sometimes they also suffer from nausea, vomiting, or loose motions as well. Now, all of this is going to also have an impact on their diet, nutritional intake, and also it is going to have an impact on their sugar levels as well. It is very important to do self monitoring of blood glucose level and continuous blood glucose monitoring in this case. Next, we will be going into how to prevent hypoglycemia. Now, as per the American Diabetes Association, blood sugar levels lower than 54 mg per dl has been considered to be a hypoglycemic episode. It is very important to maintain the sugar levels between 90 to 110. Now, in hypoglycemia, we generally see that there is sweating which occurs, or they can also feel a dizziness as well. Now, consistency in the timing and also what snacks are you giving. Frequent, small, frequent meals and also the right time of giving a snack is very important as well. Suppose if we see that the blood glucose levels are less than 70 milligrams per dl, always we have to recommend a correction of 15 gram of carbohydrate. Over here we follow the 15-15 rule. So when I say what is known as a 15-15 rule is you need to give them 15 grams of a carbohydrate. It could either be a small groundnut chicky, or it could be even 15 grams of sugar, or it could also be a fruit juice. But it should not be a high fat sweet. No chocolates are to be given. So you are going to give 15 grams of a carbohydrate to them, and after 15 minutes you are again going to recheck their sugar levels and see what is their sugar level, has it normalized or not. So this is called as the 15-15 rule. So generally what we say is that a 15 gram of a carbohydrate snack along with a protein snack is highly recommended, as it is going to help in regularizing the blood sugar levels. Now next we will go into see what are some of the tips which you can incorporate in controlling the sugar levels or glycemic control. First of all, physical activity is highly recommended for at least 30 minutes daily, which is going to also help in controlling the sugar levels in the body. Try and incorporating complex carbohydrates like millets or quinoa, brown rice. So these are having a low glycemic index, and they also help in controlling the sugar levels as well. Try avoiding refined carbohydrates like sugar or juices or bakery products as well, or jaggery, chocolate also, as these can lead to an increase in the sugar levels. Try incorporating fruits which have a low glycemic index, for example, apple, papaya, or orange or sweet lime as well. Avoid starchy vegetables like potato, sweet potato, yam, and beetroot in your diet. Okay. Also, you need to restrict on the intake of fried foods or oily foods as well. You can surely incorporate fats, healthy fats in your diet, especially omega-3 fatty acids, which are commonly found in your nuts and seeds. All right. And because this is also going to help in improving your overall heart health. Okay. And also the thing is you can incorporate A2 milk and milk products rather than consuming high fat milk products in your diet. So, to conclude, yes, regular monitoring of sugar levels when you are having cancer and undergoing cancer treatment is very important. Not only that, it is also very important to time your meals, because you need to take medications, and also you need to see as to what time can you have your meals, so that you can also keep a track on how are your sugar levels. Self monitoring of blood glucose is very important during this time. It will help you to understand how you can modify your diet as well. Next, it is also important to ensure that when if you're having hypoglycemia, always important to follow the 15-15 rule as I had discussed in this video as well. Thank you so much for watching my video, and we at ZenOnco.io are here to navigate through your cancer care journey. In case of any doubts or assistance, you can surely reach out to our cancer coaches on the below mentioned contact number. Thank you.